March 2020. It was when our lives all took turns for what we never thought would happen. As of March 20th, the United States had 19,285 confirmed cases of COVID-19 and 249 deaths. In just 1 week, this figure rose above the highest reported in China. On March 19th, California became the first state to issue a stay-at-home order, mandating all residents to stay at home except to go to an essential job or shop for essential needs. When April came, this became the new normal. The United States then had more than 619,000 cases, 27,000 deaths, and 47,000 recovered. But this economy had taken another big hit, with approximately 10 million citizens out. People were then given stimulus checks, $1,500 here and there. But this couldn't keep families up on their feet for that long. Places went from opening to opening and closing again. At first it was said that masks weren't required and that they only protected others from getting sick if we had something. Then it turned into a nationwide mandated order to wear masks wherever we go. COVID-19 created a disruption in the life of our country, a disruption that has brought grief to some, financial problems to others, and enormous changes to the lives of everyone. We were told to self-isolate and to try and stay away from others as much as we can, for the safety of our families and for the safety of ourselves. But what no one looks at is how this affected so many people's mental health. The COVID-19 pandemic and resulting economic recession has had a negatively effect on many people's mental health and created new barriers for people already suffering from the illness and any disorders. New realities of working from home, temporary unemployment, homeschooling of children, and lack of physical contact with other family members, friends, and colleagues. It's important that we look at our mental health. The COVID-19 pandemic has affected many people's mental health and created new barriers for people already suffering from mental illness. Over 60% reported disruptions to mental health services for vulnerable people, including children and adolescents, 72%, older adults, 70%, and women requiring postnatal services, 61%. Around 3/4 reported at least partial disruption to school and workplace mental health services. KFF Tracking Poll conducted a survey in mid-July where 53% of adults in the United States reported that their mental health has been negatively impacted due to worry and stress over the coronavirus. 36% had difficulty sleeping, 32% had difficulty eating, and 12% increased their alcohol consumption or substance use due to worry and stress over the coronavirus. 25.5% experienced symptoms of anxiety disorder, 24.3% said they had experienced symptoms of depression, 10.7% of all respondents said they had considered suicide. Isolation and loneliness during the pandemic may present specific mental health risks for households with adolescents and for older adults. With coronavirus taking over, many people lost their jobs, and job loss is associated with increased depression, anxiety, distress, and low self-esteem, and may lead to higher rates of substance use disorder or suicide. Even the richer population, like celebrities, like Michelle Obama, spoke about how COVID-19 and ongoing racial tensions across the country have affected their mental health well-being. Coronavirus has affected the mental well-being of those ages 18 to 24 as well, with more than half adults in the age group who responded to the CDC's June survey reporting symptoms of depression, just under half reporting symptoms of anxiety disorder, and more than a quarter reporting that they had considered suicide within the preceding 30 days. I personally went around and asked those around my age, 19 or 20, how the coronavirus has affected them. Here are some of their responses.
I would say that COVID affected my mental health because I was on social media a lot more, seeing what celebrities were doing and other just influencers, especially like on TikTok, didn't make me feel good. I was just like, wow, like they all look so perfect and their lives are all so great, and it just made me compare a lot, and that affected me in not the best way.
I had also gotten some responses saying it had affected me mentally and emotionally. I had started to have pretty bad anxiety. It made a big difference, and I started to feel sad and lonely without my friends. Not spending quality time with friends is sad because it gave a sense of belonging. It made me feel overwhelmed. The trend I've noticed in college students was depression and anxiety. With school being online, it has been a big shift with no interactions. It has made it a lot harder for those who don't adapt well to it, and students are falling behind in learning and trying to keep up with the piled assignments alongside essential jobs and balancing their own health. During the pandemic, there has also been an overconsumption of media to all, and it's terrifying how media being consumed right now is affecting everyone mentally, thinking they have to live up to the standards of those they see online. Constant monitoring of news and social media feeds can quickly turn into compulsive and counterproductive activities, fueling anxiety rather than easing it. COVID-19 has also affected many younger children in various ways. Some kids have gotten separation anxiety, in addition to the anxiety they may feel about leaving their safe home from the pandemic. When kids go out, they're often reminded how not to get too close to other people, to keep their masks on, to use sanitizer, to wash their hands. COVID-19 may add to those stresses as children worry about themselves or their loved ones becoming ill as well, but not talking about it will not alleviate anxiety. In fact, that might cause them to have more questions. The pandemic has also taken a heavier toll on Hispanic and Black Americans' mental health, with more than a third of Hispanics respondents saying that they had experienced symptoms of depression or anxiety, 20% saying they had considered suicide in the preceding 30 days, and a quarter of Black respondents said they experienced these symptoms. 15% considered suicide. The COVID-19 pandemic has affected everyone of all ages from all around the world.
Many people all around the world have felt disconnection, grief, loneliness, and more caused by the cancellation of school and events, loss of jobs and family members, and so on. Social workers are capable of working to improve the mental health of others on a micro level through counseling and/or therapy. 79% of Gen Z, which is ages 18 to 22, report loneliness this year, followed by millennials at ages 23 through 38 at 71%, and Gen X, ages 38 to 51, at 65%. These top three generations are most at risk of a decrease in mental health. Some extreme cases included depression and suicide. In fact, suicide rates have increased 10% since the beginning of 2020. In addition, 35.7 million Americans live alone. This means they have been stuck in complete isolation from everyone for the past 7 months. Overall, this accounts to roughly a third of American adults reporting feeling lonelier than usual.
To note is that the thing we're all doing, hopefully, to keep ourselves safe, which is social distancing, can have an adverse health outcome, which is loneliness. And loneliness isn't just some mildly unpleasant state. If it goes on too long, if it becomes chronic, it can lead to health problems, like, as Dr. Jen would tell you, heart problems, depression, dementia, and this is if it goes on too long. So you really have to keep an eye on it.
As you can see, many people suffer from feelings of loneliness in these tough times. But being able to talk to someone who understands can make a dramatic difference in attitude and feelings. For those who have faced great loss and have faced economic or emotional instability, counseling can be used to reinforce positivity, change, and provide an environment to implement solutions.
They're wondering if maybe this is goodbye because they don't know how long she'll live.
Te estoy extrañando mucho acá, que tú eres una guerrera, que tú eres la mamá de mi mamá.
Ms. Toro's family is scattered across the U.S. and in Colombia. With the pandemic, there's no way that they can fly to come together, and they want to be there for her.
Abuelita, así estemos lejos, aquí estamos todos por ti.
Madre hermosa, acá estamos todos, mamá, explicándole a Dios.
¿Cuánto daría por estar allá? Poderte abrazar, poderte besar y decirte cuánto te amo.
Abuelita hermosa, mira tu amorcito aquí dormido. Lo tengo en mis brazos dormidito como te encantaba verlo.
Although we cannot force the pandemic to end, we can come together as a community to be there for each other. Support and reassurance serves a great purpose, especially for those who are directly impacted by the pandemic or who feel or are completely isolated.
Social work is also known as a helping profession. Its mission is to enhance the well-being of individuals and secure the basic human needs, rights, and values such as food, water, shelter, and intangible resources like emotional, economic, or social support, with a focus on those who may be vulnerable, oppressed, or living in poverty. As a guide to pursue this mission to the best of their ability, social workers have 6 core values. These values are service, being able to supply resources and opportunities that will maximize the client's potential. Social justice, which is the endless effort to protect human rights and needs despite their identity. Competence, the ability to effectively put learned knowledge and skills as well as experiences to use in client situations. Dignity and worth of the person, being able to respect their beliefs and acknowledge their true identity. Integrity, fully disclosing information and remaining to adhere to ethical decisions. And lastly, the importance of human relationships, meaning sympathizing with their clients and building a strong connection to enhance development.
While working to meet the needs of the client, the overall goal the social workers have in mind is infusing change into the lives of individuals and into the society to reduce the negative effects of personal distress or social inequality. This can be done by engaging in actions that advocate for the conflict at hand, analyzing factors between the person and their environment, as well as efficiently using resources that will most benefit the client. With that being said, the issue of COVID safety responses and concerns within mental health goes hand in hand with the profession of social work. Social workers are in the position where they are capable of promoting methods that can prevent the spread of the disease, along with the ability to advocate for matters like mental health due to the pandemic. In addition, social workers are experienced in utilizing methods that represent their practice, such as the advocacy practice and policy model and its 4 tenets, which can be used while addressing this issue. For example, economic and social justice can be seen for reasons such that an individual needs assistance from a social worker because they are not eligible for insurance that covers private mental health counseling and must resort to government-funded organizations. Or, in regards to human needs and rights, a person suffering a mental disorder may need support from a social worker who will be patient and committed to helping the client get better and understand their circumstances. On the other hand, having a supportive environment can play a role in relation to COVID safety responses. For instance, being in a community that respects and follows the regulations of COVID-19 can decrease the risk of catching the virus, which can limit the factors that impact mental health, like a family member possibly being hospitalized with COVID or even losing them. Currently, there is an increasing number of situations that involve mental health services and a constant demand for the advocacy of COVID-19 safety responses in which the skills and experiences of social workers come into play.
Mental illnesses are often associated with affecting only individuals, and their effects on groups can often be forgotten. Families, organizations, and the entirety of the U.S. workforce are joining this global mental health crisis caused by the COVID-19 pandemic. The American Academy of Child and Adolescent Psychiatry explains the effects of mental illnesses on families and the children in them. Parents who experience symptoms of mental illness are more likely to have children who develop mental illnesses. Families experience stress, anxiety, and depression on a day-to-day basis because of things such as money or housing insecurities. Now imagine trying to handle those forms of stress during a global pandemic. The COVID-19 pandemic rapidly increased the negative well-being among families when it comes to mental health. Duke University conducted a study that surveyed the daily mental health well-beings of a certain number of families as the pandemic continued. The most common issues households began to experience throughout the time of the pandemic was negative moods, getting less sleep or not being able to sleep, as well as children misbehaving more often. Children are witnessing the distress on their parents or guardians and are acting out as a response. After shutdowns and closures were enforced, the workforce became heavily impacted. Majority of people work in order to make a living, and all of those people's jobs were affected. Jobs lost, lack of hazard pay, fear of getting sick, all factors that society had to face just in order to live. The extreme level of uncertainty is leading to feelings of loneliness and isolation and is creating a fear of mental illnesses such as depression among our society. Some of these feelings even include burnout for those who are working remotely. These changes in the meso and macro levels of society are showing the multiple and constant fears that groups of people are facing. With society crumbling at our feet and people passing as we speak, we are all living in a constant state of fear. Parents are losing their jobs, children are attempting to learn from their bedrooms, and no one knows exactly what is right or wrong. During a scary time when the country should be coming together, society decided to move further apart. While some decided to party on the beach, others protested to protect people's rights. Some wear a mask whether they believe it helps or not, and others don't, ignoring the safety of themselves and the safety of others. Not to mention, this is all during one of the worst controversial elections that the country has ever seen. Rather than pushing differences to the side, we became more separated than before. Events such as these have caused more concern about explaining topics such as racism and police brutality, along with what a pandemic is and why we are in one, and how people are going to explain these to young children. The list of triggers for mental illnesses seems to grow with every week that goes by. While the virus has been seen to harm people of all ages, it can also affect the mental health of people of all ages. Children and teens have been showing more physical displays of emotion, such as crying, headaches, and changing their eating habits, while seniors and those with disabilities are becoming more irritable, also changing their eating habits, and having emotional outbursts. All of these changes in emotions can damage the foundation of families.